The most common situations that we will use chemotherapy is when a pet has a systemic type of cancer, such as lymphoma, where it is the primary means of treatment. We may also use it for those tumors that we're not able to remove or may have already metastasized, or we can use it as a follow-up to surgery to try to prevent or slow the development of metastatic disease in the body down the line. Chemotherapy can be given in several different ways, and a lot of that depends upon the type of drug and the type of cancer that we're treating. There are some medications that are given orally and that they can be given in the hospital with us, or they may be sent home with clients to be able to give at home. There are a number of drugs that are given as intravenous treatments, and when we give an intravenous treatment, the typical way that we do it is we'll put in an IV catheter and we'll slowly give the drug anywhere from over 2 minutes to 30 minutes, depending upon the type of drug. We normally will have 2 of our technicians sitting with the patient in order to keep them calm and more relaxed, and that once they've finished their intravenous treatment, we'll take out their catheter, give them a Band-Aid, send them on home. For the most part, we try to do our treatments on an outpatient basis so that patients don't have to spend a lot of time in the hospital, which is important because it's really nice for them to be at home doing the things that they normally like to do. There are some treatments that may take longer, so they may need to stay for part of the day, but we try to minimize the amount of time that they spend in the hospital. Most of our patients don't require sedation when they're getting chemotherapy. It depends a little bit upon the situation and the drug that's being given and every individual patient. Some patients can be more rambunctious, so that we may choose to use some light sedation so that they can be still for their treatment. Some of our patients are anxious about coming into the hospital, so in some cases, we will send clients home with medications that they can give prior to the appointment to try to reduce the level of anxiety. We want to make this as pleasant a experience for our patients as we possibly can so that they're willing to come back and see us. And it doesn't hurt to give them lots of extra treats too as well while they're here with us. Many of our clients have opinions about chemotherapy before they come to see us, and most of that is based on experiences with other humans that have gotten chemotherapy. But we do stress that it's very different in our patients compared to people. First and foremost, we do not use the same dosages and combinations that they would in a person, so that the risk of having a serious side effect is much lower. Secondly, most of the cancers that we're treating with chemotherapy do not make our patients feel sick, so patients are better able to handle chemotherapy if they're not already sick from their cancer. One of the things that we do stress in veterinary medicine is the most important thing is their quality of life, and we do not want to do anything with chemotherapy that takes away from the quality of life and the time that they have with their owners. The way chemotherapy works in general is by killing rapidly dividing cells. And those are cells that are cancer cells, those are cells in your GI tract, and those are cells in your bone marrow. So the most common side effects that we would see would be gastrointestinal upset, and that could include nausea, vomiting, a decreased appetite, or diarrhea. We do stress that in most cases it's going to be self-limiting. It lasts a day or two, and then they're fine without us doing anything more. We can also see a drop in the white blood cell count, and this occurs usually about 7 to 14 days after treatment, depending upon the particular drug that is given. And the reason why we worry about a drop in the white count is it can make them more susceptible to infection. These infections often come from bacteria that are already in their body, so I don't necessarily recommend that patients be isolated or not go to other places, that they can still go and do their normal activities. We do follow the white blood cell count on a regular basis before treatments and in between to make sure that it's safe to continue giving the chemotherapy. There are also some other side effects that are specific to certain drugs that we use. One of the most common questions that we get from our clients is, will my pet lose their hair? And in most cases, the answer would be no, because they have fur and their coat is not continuously growing like our hair is. However, there are breeds such as poodles and Afghans that have continuously growing coats so that they will have a thinner hair coat, but that's just cosmetic. The hair will grow back in, and once we finish the chemotherapy, and it grows back in normally. There are several other side effects that we can see, and we would have a longer discussion about these side effects depending upon the drugs that are being given. One of the drugs can rarely cause irritation of the bladder. That would look like a urinary tract infection. One of the drugs can rarely cause changes in heart function, so we will limit the number of treatments of that particular drug. We can rarely see changes in either liver or kidney function with specific drugs. These are side effects that we would talk to a client about if we were using that particular drug so that we would be able to inform them if there's something different about that chemotherapy drug. But for the most part, our main concerns are about either gastrointestinal upset or a drop in the white blood cell count. Additional side effects that we can see with chemotherapy can include a reaction at the site where the chemotherapy is given. This would show up as either redness or swelling at the site where the chemotherapy is given, or your pet may start licking at the site or chewing at the site. This is one of the reasons why it's so important that our patients be still during their treatment with chemotherapy, and that we have highly skilled nurses that administer the chemotherapy as they are trained in the right way to give chemotherapy. We can also sometimes see allergic reactions with certain chemotherapy drugs. If we were to see an allergic reaction, it usually occurs within the first 30 minutes after giving the drug. There are some drugs that we may consider giving Benadryl, which is an antihistamine and sometimes a steroid to, before giving that particular drug. There are drugs that can affect particular organ function. For example, there's a drug called CCNU or lomustine that rarely can cause changes in liver function. So it's important that we monitor liver values when we're administering this particular drug. And in cats, their drug doxorubicin can rarely cause changes in kidney function, so we have to limit the amount of drug that we give, as well as make sure that their kidney function is normal to start and is remaining normal. We do have a number of medications that can be used for side effects. Depending upon the clinician, we often will send patients home with medications to be given or to have at hand if it's needed for nausea and vomiting and for diarrhea. We often will use drugs such as Cerenia and ondansetron for nausea and vomiting, and then metronidazole for diarrhea. I will also use injectable anti-nausea drugs with several of the chemotherapy treatments in order to try to prevent any issues with nausea and vomiting. If these side effects do occur, in most cases, they're about 2 to 5 days after treatment, and they usually last for a day or two, and then they're fine. We would treat them very much like we would any gastrointestinal upset, bland diet, small frequent meals, and then we have the medications that we can use for the side effects. And I would rather people use the medications early to try to prevent there being issues that get worse later on. If your pet is experiencing side effects from chemotherapy, in most cases they are minor and that they can be taken care of at home. If you are seeing signs such as vomiting or decreased appetite, we often would recommend that we use the medications. If you don't have any medications on hand, we can call medications into a local pharmacy for you. Often, small frequent meals, a bland diet, a home-cooked meal will get patients to start eating again. If you have a patient that is vomiting excessively, multiple times in an hour, is very lethargic, is having diarrhea that's lasting more than 24 hours or is very watery, or if there are concerns about overall breathing, then we would recommend that you seek emergency care for your patient or call your oncologist for further recommendations. One of the common questions that we get from our clients is, Can they leave their patients alone? And the answer is absolutely yes. In most cases, the side effects are ones that may develop several days after a treatment. And if you were to go to work and come home and find that your pet wasn't feeling well, it's something that we would still be able to deal with. One of the reasons why I treat our patients with chemotherapy is so that they can go out and do their normal activities. We want dogs to be dogs and cats to be cats. And if we keep them in a box, then they're not living the life that they need to be living. So I do not have any restrictions on what our patients do. They can go other places. They can be around other dogs. They can go to the dog park. They can go to daycare. As long as your pet is feeling well on the day that we do those activities. If they aren't feeling well, then we would recommend that we restrict their activities and then call your veterinarian if there are side effects that are concerning. We will monitor them to assess whether their cancer is responding to treatment or if we see any of the cancer recurring. We will also monitor things like weight. I feel like weight's very important. It tells us a lot about how a patient is feeling. Are they eating well? Are they happy? And then we monitor white blood cell counts. And how frequently we monitor white counts would depend upon the particular drug that we're using. If we know that a patient has a low white count, we may elect to skip a treatment. We may lower the next dose. Or if the white count is low, we may also start them on antibiotics as a precaution. Having a patient receiving chemotherapy is sometimes a scary thought, but I think with common sense, we can keep both our patients and our human parents safe from the effects of chemotherapy. It's like handling a lot of other household chemicals that are in the environment so that you take common sense precautions. Wear gloves, wash your hands well, clean up thoroughly after they urinate or defecate, and in those cases, the exposure that people are going to have is going to be limited. If you do have specific questions or concerns, it may be something that you'd want to address with your physician. Clients always ask if they're making the right decision to pursue chemotherapy. And one of the things that I absolutely stress is that there is no right or wrong decision in this situation. In most cases, when we have patients with cancer, it may not be a cancer that we're able to cure, but our goal is to maintain their quality of life for as long as we can. I do tell owners that if they start chemotherapy and they're not happy with the side effects or the cancer is not responding, that we can sit down and have a conversation and that they can decide about whether they want to continue with chemotherapy or not. We can make changes in the dosing, we can make changes in the drugs, depending upon the underlying issues. But it's always a decision that you can make as to whether you're comfortable with treatment, and you don't have to feel you're making the wrong decision. The goal of chemotherapy is absolutely to maintain their quality of life and to maintain that balance with the family and with the patients so that both the family and patients have the quality of life as close to normal as they possibly can, because it's important for our patients that they're companions, and so that we want to treat them very much like family members. We know that treatment of cancer can always be a scary thing to go through, particularly when it's your pet that has cancer. You have to remember that when you come in to see us, you're now part of a team. That includes yourself, your veterinary oncologist, the veterinary technicians that work with oncologists, and also with the client care team. If you have any questions, we always recommend that you contact us. There's no question that's too small or too silly for us to answer. We're always happy to go back over information for clients because it's a lot to take in, it's a lot to process, and we know that you're making a big decision. Your oncologist may not be in the hospital all the time, but there are people that are there to help you. If you feel that your pet is having an urgent emergency, we recommend either contacting the main number for our hospital, your family veterinarian, as they can often help in these situations, or another local emergency clinic.